Good afternoon. I'm Jan Mold, the Deputy Director of Competitive Events for hosts of Future Health Professionals. And today I'm going to be talking about a topic that you may have heard of, but I want to talk a little bit about what the issues are and what the solutions may be. And the title of this is Health Disparities to Health Equity. Health disparities is defined by Medline Plus as health differences between different groups of people. Those differences may include the incidence, the severity, the complications, the mortality, availability of care, and screenings conducted. It's estimated that disparities cost in the United States $93 billion in excess medical care cost and $42 billion in lost productivity per year. So we're not talking about a small problem by any means. So I want you to watch Michelle's story.
The world has got to change. I lived in a community that was so prosperous with doctors and lawyers and politicians. Now we have drug dealers and corner stores that they don't sell anything but the wrong things. You cannot deny the impact that it has on people's health. I had been in West Baltimore my entire life. As far as money, my mother didn't have any money. I don't want to say she was poor. I'll say low income. Poor we were, though. In the 50s, we didn't have many choices as far as healthcare. The healthcare system then was limited. It was not good for us. And medicine costing so much that my family says sometimes, will I eat or will I pay for my medicine?
Which one do you, Mommy?
Oh, I just love my daughters when they come over and we get together and we cook and prepare meals together. It's healthy meals. When my oldest went to college, she came back with a different diet.
Now what happens is if I do a meatloaf, it's turkey instead of ground beef. You know, I make spaghetti, I make chili, stuff like that. It's with turkey and chicken. We grew up, we ate pork. We ate bacon, we ate a fresh shoulder, we ate pork chops. I did not think it was not healthy eating.
Right.
Because this is what we were accustomed to. I was in denial. I didn't want to face the fact that I was becoming a diabetic.
The impact is the fact that my family ended up with heart disease, emphysema, diabetes, cancer. My mother's sister, her daughter, died of diabetes. She was an amputee. My mother died of a massive heart attack. And
to address health disparities, we need to understand why they exist, that they're not due to one single factor. They're the result of policy decisions we make as a society. They're due to the environment, health education, insurance and access to care, access to healthy food, and stress. Those stresses are actually experienced disproportionately by people who are poor and people who have been historically disadvantaged in this society.
solutions to these problems cannot just be medical. It's systemic. And that means everybody has to get involved.
If we want a nation to be strong, the people in that nation have to be healthy. They have to be well. If there's anything that we can do to stamp out disparities, we need to do it by any means necessary.
Hi, Ms. Simmons.
I don't.
Here at East Baltimore Medical Center, most of the patients are underserved.
We need nice deep breaths in and up through your mouth.
Michelle is a terrific success story. There was actually a year where she had lost her job, and before she found a new one, she had no health insurance. And she still managed to buy her medicines out of pocket, paid out of pocket to come and have doctor visits. She was really invested in her own health. That's something that Dr. Cooper's research is looking at, why patients don't invest in their health like we wish they would.
The next thing on the agenda is the community update, so I'm going to...
Michelle joined our Community Advisory Board in 2011. We provide education to the community about health and about research. We offer training programs for community health workers. we can be sure that we are meeting the needs of people appropriately and that we're not leaving out certain groups of people that have traditionally not been included in conversations related to health and health care. Our strong relationship with the community is just essential. There's no way that we could do what we're doing without their input. And my work is just one of many initiatives here at Hopkins.
Good to see you.
Ms. Simmons is a great example of what happens when we get it right as clinicians and as an institution.
I am a fighter. I am a believer. I stand for what's right. And what's right is people's health. And I will never give up as long as I have breath in my body.
One of the things that is so important is that people have what I call a liberated future. And it's hard to be liberated when you're not healthy. When I say liberated, I mean freedom to be all that God meant for you to be. When we don't deal with disparities, then what we're doing is denying people an opportunity to get back to the world. So we've got to fight it. We've got to fight it with everything we've got.
Vice Admiral Dr. Murdy, who is a former Surgeon General and also the current Surgeon General nominee, says that if we want to improve the health care of America and make it more equitable, what we have to do is engage businesses in our community to be change makers. We've got to improve and sustain health in the community. We've got to strengthen communities to make them places of opportunity for health and prosperity. You probably have heard of Healthy People, and Healthy People 2020 lists the following factors that may contribute to the ability of an individual to achieve good health. And those include ethnicity, sex, sexual identity, age, disability, socioeconomic status, and geographic location. The focus now is on health equity, which means the attainment of the highest level of health for all people. And the influences on health that Healthy People 2020 named include high quality education, nutritious food, decent and safe housing, affordable, reliable public transportation, culturally sensitive healthcare providers, health insurance, clean water, and non-polluted air. One of the things that the American Medical Association has done is released a resource that's to help physicians and their office staff in eliminating healthcare disparities. And it's entitled Working Together to End Racial and Ethnic Disparities, One Physician at a Time kit. Again, focusing on the folks that are in frontline positions. Dr. Zhao, who was president of the National Academy of Medicine, says a diverse workforce is a key attribute of quality health care. So let's talk for just a couple of minutes about Black males in healthcare. They make up 13% of the U.S. population, but less than 7% of the medical students and less than 3% of practicing physicians. Dr. Zhao also says we have to recognize that bias and racism are the fundamental causes for the lack of Black men and women pursuing careers in science, engineering, and medicine, and the increasing health disparities as being bias and racism. Discrimination, prejudice, and unconscious and conscious bias create exclusionary environments that prevent Black men and women from entering the pipeline and pursuing careers in science, engineering, and medicine. So what are some of the things that are being done? Academic advising and counseling, academic and study skills training, leadership training, mentoring, special events, and/or workshops. I read somewhere that one of the best indicators of where you'll end up in the future is who you hang with when you're in high school. And I want to share a story of 3 young men who really hung out with the right people. They've written a book called The Pact, which in 2013 was included on HOSA's medical reading list.
Okay, I got your W-2s. Just a few more questions.
That's Dave, a free TurboTax live tax expert.
The pact was a promise that we made, me, George, and Sam, with each other when we were in high school.
We did the unconventional thing and made this promise to one another to become doctors. And so, growing up in Newark, that was often far-fetched to see a young person aspire and aim for something like education wasn't a commonplace thing.
And it seems like everyone's telling us it's not cool. Everyone's telling us college is hard, and all these sorts of things that made looking towards our future and using education as something more difficult than it actually was, or even impossible. We kind of found each other as we were having those thoughts individually, began to bond on how are we going to figure out how to get out of this situation. But our pact was more about our friendship, and we knew that once we decided to do this together, that we were going to see each other through. We just began supporting each other and helping each other ever since.
So we made this promise to become doctors and went off to college together at Seton Hall University, and then from there off to medical school and dental school at Robert Wood Johnson University in New Jersey, and we became doctors and dentists.
Newark is tough. Newark is still tough, unfortunately. We saw a lot of our friends in our neighborhoods falling by the wayside, getting in trouble, their older brothers, and even family members of ours just having lots of issues growing up in the inner city of Newark. I wasn't so lucky initially. It wasn't until I really took our pact seriously and made sure I stayed around Sam and George that I, stopped getting into trouble.
It's tough for a young mind to aim for something positive because there's no reinforcement of what is positive. So for me, it was often use those negative images to imagine something better.
It's a responsibility that I feel like I have to go back, because I know a lot of these kids have talent, and they might squander it just because they get caught up in the wrong situation. And so that's why we go around and we try to tell our story and try to be role models to these kids. We get to give back. We get to talk to students. We get to be one of the first people, it seems like often when we get in front of a group of kids, to really begin to convince a lot of these kids of their possibilities.
We created the Three Doctors Foundation. We've written several books. The first one, The Pact itself, which chronicles our life. And the purpose of that book was to give back, was to show other kids and coming behind us that it can be possible. Whatever you want to do in life,
the pact saved our lives. I'm reminded of something that my grandmother said to me. No matter what you do in life, it's going to be hard. So you might as well pick something positive and you enjoy the benefits or the fruits of your labor in the end. And I think that's really the message. Like, no matter what happens in life, no matter what you do in life, bad, good, whatever it is, it's going to be a journey. It would be wise to pick something that's good, because then at the end we reap the benefits. And so I hope that they learn from our story, they learn from our pact, and know that no matter what your struggle, you can really achieve whatever you put your mind to.
HOSA also had the pleasure of having Dr. Davis as a keynote speaker for one of our ILCs. If you're interested in this topic, there's a couple of things I want to point out to you. There is a HOSA competitive event, a written test, cultural diversity and health disparities. Also this year, 2021, a public health topic is on health disparities. I hope for you that you'll find your pact and set your goals high and work hard to reach them. Because HOSA is asking you to be part of the solution to end health disparities and to move to health equity. We want you to be part of the solution. So the question is, what could you do to meet that goal? Thank you.